JES Foundation Repair, the Virginia Department of Emergency Management, and the Virginia Department of Health are proud to sponsor this special news presentation. Tonight, a virtual town hall with the leaders of our Commonwealth. Virginia Responds, your questions answered.
Thank you for joining us tonight for Virginia Responds, your questions answered. I'm Juan Condi. This pandemic's affecting all of us, forcing businesses to close, schools to shut down, and it's taking the lives of hundreds in our Commonwealth. We've seen Virginians come together in these dark times, making masks for each other, collecting donations, and looking out for neighbors. The pandemic, though, continues, and we may not have reached its peak. There are 9,630 confirmed and probable cases tonight, with more than 1,500 people hospitalized and 324 fatalities. Now, we all have questions from when can we reopen our economy to how can we keep our kids safe. Joining us tonight for this virtual town hall is Virginia Governor Ralph Northam. Governor, thanks for being with us this evening.
Juan, thanks so much for having me. Thanks to your network for doing this, and for that matter, the other networks. We have our press conferences several times a week, and we really appreciate you being there to make sure that our Virginians get accurate and updated information. And I'd also like to thank all the Virginians that are viewing tonight for being part of the solution. We're all in this together. We're fighting a health crisis and an economic crisis, and just as soon as we can get this health crisis behind us, we'll be able to get the economy back up and running and return to our normal lives. So thanks for what you're doing.
Thank you for giving us access to your knowledge, because we're going to go through a whole bunch of questions tonight that come straight from you, the viewers at home. A new New York Times report shows Virginia among the states with the lowest rates for testing in the country. Let's take a look here at this graphic. We have Puerto Rico with 13 per 100,000, Kentucky with 19 per 100,000. Virginia's at 23. Why have we been so low, Governor, and what are we doing to improve those numbers? Our first viewer question of the night is about, well, let's answer that first, then we'll go to our viewer.
Well, there's several reasons, Juan. First of all is the supply. We're still competing with other governors, with other states, with our healthcare systems for the supplies we need. And the other point I would make is that the testing has been very cumbersome. If you look at how this all started, we had our first case in Virginia on March the 7th. And initially, every test that we did in Virginia was sent to Atlanta to CDC. The turnaround was days. And then our state lab here in Richmond came online. And then private labs, Quest and LabCorp being two of them. And then universities, VCU and UVA came online. And now healthcare systems have come online. So we're getting better every day. We're testing between 2,000 and 3,000 individuals in Virginia a day. As you said earlier, we had 640 positive cases today, 24 additional deaths. So this is a real situation. And in order to ease some of these restrictions, we really need to ramp up our testing, probably to the 10,000, 13,000 a day range.
And that will ensure all of our safety. Let's go to our first viewer question of the evening. They're asking about testing. Let's take a look here.
I'm interested in contact tracing. Can you tell me what your plans are for that? And is there a place where I can volunteer for that?
Okay, so contact tracing. Can you explain that to the viewers? You're a medical doctor, and how we might be able to ramp that up in the future.
Great. Well, the question is about contact testing. In other words, if I think I may have been in contact with someone else that had the virus, then where do I go for testing? And again, supplies have been an issue, and we have had to use certain screening criteria. If someone was in contact with someone that tested positive, if someone had a fever, a cough, shortness of breath, because we just didn't have the capability, the capacity that we needed. But we're coming up to speed on that. Just yesterday, as the viewers probably know, we announced a testing task force that will be run by two individuals, Karen Remley, Dr. Karen Remley, who used to be our Commissioner of Health, and Dr. Peak, who is one of our epidemiologists. And we're really doing that to coordinate the testing capabilities across Virginia. As I've said, we've had to use these criteria, but we need to reach out and be able to test more people. And also, because it was so cumbersome, a lot of providers, a lot of the doctors, nurse practitioners, PAs, have chosen just to make clinical diagnosis, because the turnaround time for the testing has been sometimes 5 to 7 days. So we wrote a letter yesterday to our providers so that, you know, our testing is better now. So we really encourage you to do those tests so that we'll have more data and can better follow this virus.
And there are also more efforts now to be in underserved communities here in the Richmond area.
That's a great point, Juan, and we are reaching into the underserved areas, and one of the things that we talked about with this new task force is even have a mobile testing process, so that we may have like a van that goes around to neighborhoods. You know, we'll announce when we're going to be there, but we want everybody in Virginia that needs it to have access to testing.
That capacity, though, is on the rise.
Yes, it is.
Our next question comes from a young viewer in Suffolk named Shelby, who has a question about education. Let's listen in.
I was wondering if you, what you know about the plans for the beginning of the next school year and how that's going to work out for the Suffolk schools.
Still very much.
Thank you.
Oh, thank you, too. Still very much unknown about how schools will operate as we go into the fall. What sense of that do you have this evening?
It's a great question, Juan, and that was probably one of the toughest decisions that we had to make this year, and that was to postpone schooling till the fall to close our schools. And I did that because we were looking at the data, looking at when the peak or the surge would be, and it still looks like it's in late April, early May, and I wanted people in Virginia to have consistency and certainty as we move forward. But I will tell you that our teachers have really stepped up. We have a program called Virtual Virginia now, which reaches out to children across Virginia. 4 of the public networks in Virginia are offering instruction on the TV. One of the points, though, it's important to make, and I hope all Virginians hear this, when we talk about equity and being able to reach out to all children across Virginia, we know now how important broadband is. And this is something that I have been working on for the last several years, the funding for that. But you know, that last mile, when certain children and their families have access to broadband and others don't, then you know, those individuals are at a disadvantage. So I think the caller wanted to know, what about the fall? And I can't predict what's going to happen tomorrow necessarily, but you know, if we continue to do the things that we're doing in Virginia, the social distancing, flattening that curve, I am hopeful that our children will be back in school in late August, early September. So that's what our goal is.
We're all smiling, right? Millions of parents in the Commonwealth will smile as well when that day comes. Our next question from Chesapeake. Bill Wright is asking about opening the economy.
It does look like we have some serious hotspots in the state, specifically Northern Virginia and Central Virginia. And my question is your administration, with all that data, talking about reopening the Virginia economy on a regional basis as opposed to an entire statewide basis? Okay,
you've mentioned this before in your news conferences. What are the barriers to reopening our economy regionally as opposed to as a blanket?
Well, that's a great question, and I appreciate that. And there are hot spots in Virginia, and this virus tends to be more successful, if you will, in areas where there's density. But I will remind folks that this virus knows no borders. It knows not where the counties are and even where our state borders are. So I have tried to be consistent and make the decisions that we have made on a statewide basis. As far as when we can start lifting these restrictions, as people know, we have a stay-at-home order through June the 10th. Our businesses, non-essential businesses, have been asked to stay closed through May the 8th. I would love to get the economy up and running before then, but we need several things. We need to make sure that we have the necessary PPE. You've heard us talk about that before, not only for our hospitals, our nursing homes, our first responders, those that work on the front lines in our grocery stores, for example. We want them to be safe, and we want their families to be safe. We also need the testing. We talked about that a little while ago. We're ramping that up. Our capacity is increasing, but we need to be able to test and then track those individuals and contacts, and then if need be, we need to isolate individuals. So when we have all that where we're comfortable, where we can move forward safely and responsibly, we look forward to easing some of these restrictions and getting people back to their lives.
And this would also include, to some extent, to the extent that you've mentioned so far, regional cooperation with our neighboring states, so we're not so far out of sync with what they do, which could mess up what we want to do ourselves.
Absolutely, and I've had a great relationship with our governors in Maryland and North Carolina, and also our mayor up in Washington, D.C. So we have worked closely together. We talk several times a week, and again, we want to be consistent. So as for an example, up in Northern Virginia, we have the Potomac River that separates two large, dense populations. And so to get rid of some of the confusion, we want to try as best we can to move forward together.
Right, that river isn't really a boundary or a border for anyone.
One other thing, Juan, too, if I can add, when we talk about easing the restrictions, the CDC has come out with guidelines. They were talked about by President Trump on Thursday, 3 different phases. But in order to get into that first phase, we need to have 14 days of decrease in numbers of new cases each day. And while we've seen some flattening out of the numbers over the last few days, we're nowhere near the 14 days. So I know everybody is chomping at the bit to lift restrictions, but we need to do it safely.
You're waiting for the data to catch up.
Absolutely.
All right, summertime's almost here. It's bloom outside and lovely sunshine. So we're worried about 4th of July. Let's take a look at this question. This is a video from beaches in Jacksonville on Saturday, about 20 minutes after they were reopened. What is the plan for Virginia beaches?
Well, it's a good question, Juan, and again, we want to be safe. We know that this virus is spread by aerosolized particles. In other words, when people even breathe close to each other, or they sneeze or cough. So a lot of our guidelines have been centered around keeping people, the social distancing, keeping people 6 feet away. If there are gatherings, to have less than 10. And for the most part, Virginians have abided by those, and I commend Virginians. But when I look at pictures like the beach, where people are congregated and in close proximity, sitting on towels, blankets, that's not in anybody's best interest. And so while I'd like to say by July this virus will be in our rearview mirror, we just have to take one day at a time. Until we have a vaccination, which people are saying a year and a half, I think this virus is going to continue to be out there in our communities. And so we all, as Virginians, need to be careful and follow these guidelines. So as far as festivals, large gatherings this summer, I wouldn't recommend those right now.
All right, well, let's move to the stay-at-home order itself. It really is getting under the skin of many people. There have been protests, one last week. There's another scheduled for tomorrow. We're looking here at video from Capitol Square last week, folks calling for you to reopen the economy and to rescind your stay-at-home order. Let's take a listen here to one of the demonstrators.
I would like for the governor to get the message that we're tired of tyranny.
Just because other governors have also overreacted doesn't mean he has to.
All right, what would you say to folks who accuse you of tyranny? Is that a reasonable interpretation of what you're trying to do?
Well, I would remind folks that my job as governor is to keep Virginians safe and to save lives, and also to remind them that on Thursday, our president, through the CDC guidelines, told us that we need 14 days of decreasing numbers. And while I know people are frustrated, you know, I'm frustrated. We all want to get back to our normal lives, but we need to do this in a safe and responsible way. So I don't really need protests to encourage me to lift these restrictions. What we need right now is to work as a team. We need to put this health crisis behind us. We need to make sure that we continue the social distancing, the guidelines that like washing our hands, good hygiene. We know these things are working, and why is this important? I just want to emphasize, I'm a physician. I have been on the front lines. I have been in the ER. I know what these providers are going through. It is not easy. They're putting themselves at risk. They're putting their families at risk. They're tired. They're going to work every day, and I commend them for doing what they're doing. It is not easy work, but I would ask all Virginians to think about those people, to not put those people at more risk, and those people and their families. Let's do this as a team. As our vice president told us yesterday in a discussion we had, one team, one mission. That's where we need to be right now to get this health crisis behind us.
All right. Let's move now to Andy Fox, a reporter out in Norfolk, who has a few questions of his own. Hi, Andy.
Governor Northam, hello, and Juan, thank you very much. Governor, the first question is, governors from Georgia, Tennessee, and South Carolina are all reopening without bending the curve. Are they wrong? And if they're not wrong, is Virginia far behind?
It's a great question, Andy, and you know, I have watched, again, I am doing everything that I can to follow the CDC guidelines that came out of the White House on Thursday. You know, I've got my hands full dealing with Virginia. I'm not going to sit here and judge what they're doing in other states, but speaking on behalf of Virginia, I'm going to do what's in the best interest of 8.5 million people. I'm going to do everything that I can to keep them safe, to get this health crisis behind us and get our economy up and running again. And one of the things that I like to remind Virginians of, prior to COVID-19, Virginia was the #1 state in this great country of ours in which to do business. Our revenue, believe it or not, in March of this year was 10.8% higher than March of last year. Our economy was literally on fire, and then COVID-19 hit. So we went into this strong, and I'm going to do everything that I can as governor to make sure that we come out of it strong, and I'm confident that we will.
All right, Governor, thank you very much for that. My next question, my understanding is that hospitals are no longer overrun. We have a lot of empty beds around Virginia. Is that true? And I understand that it is true. What does that mean?
Great question. And by the way, Andy, I miss being in 757, so thanks for all that you do. But it is good, Juan, to be here in 804.
It's okay. You can. Everybody can get a little bit of the governor.
Yeah, all the area codes are good. But you know, Andy asked a great question. The hospitals have really cooperated. We were very worried and still are concerned that, you know, when this peak, when this surge occurs, are they going to have the bed capacity? Are they going to have the PPE they need? Are they going to have the staffing and ability to test? And so they have stopped all elective surgeries. And I just had a great discussion with our hospital CEOs this afternoon and talked about when can we safely reopen our hospitals, our healthcare systems to outpatient surgery, to elective surgery. And so that's a decision, working with the CEOs, that I'll probably make in the next couple of days. But we want to make sure that our consumers, our patients, know that the hospitals are safe, that if they need to go in for surgery, whether it be emergency or elective surgery, that they're going to be safe, they're not going to be exposed to COVID-19. So we're working on a plan, and hopefully we'll be able to announce that in the next couple of days, because, you know, the hospitals, to eliminate elective surgeries, that affects their bottom line. And they're a business like everybody else. So we want to make sure that we can get them up and running as soon as we can, and we do it in a safe and responsible way.
All right, so that capacity appears not to be a problem. What other questions do you have, Andy?
Governor,
one more.
I have time for one more question. I have one more question, and then I'll be out of time, Governor, and thank you very much. What is the state doing to prepare for a possible phase 2 of COVID-19, which some experts say will be worse than the first phase? And is it fair to say that we will be open for business by June 10th?
The question is great, Andy. It's what are we doing to prepare for phase 2? You know, if we as Virginians can continue to follow the guidelines, the social distancing, the groups of 10 or less, the hygiene, then we can keep that curve flat and hopefully let this virus move away from this country of ours and the world for that matter. What we worry about is if we do reopen too soon and we have that second phase that puts a burden on our hospitals, on our nursing homes, etc., it could be as bad as the first one, and we would be right back to where we started. So this is a time when I ask Virginians to just be patient. Let us follow the data. Let us follow how many new cases there are each day, and just as soon as we can, we will ease these restrictions. But I think all of the experts would tell us that if we do that too soon, we're asking for trouble. So right now, we just have to keep our foot on the pedal and keep doing what we're doing because it's working.
All right, let's talk a little bit about PPE. Last week, thank you very much, Andy Fox. Don't want to forget you there. All right, our next question is about PPE. Let's show you some video here. Because across the state, emergency responders and volunteers need these protective masks and gowns. You mentioned last week that we received our first supply from a deal the state cut with a private supplier. What is the status of our PPE this evening?
Well, it's better every day, and I couldn't be prouder of folks in Virginia. A lot of manufacturers, a lot of people have stepped up and said, how can I help? How can I be part of the solution? But again, just to back up, Juan, we are fighting a biological war. And we started fighting this war without the supplies we need. There was no guidance from the national level. And so what we've had to do as governors is we're competing with each other. We're not only competing with governors, we're competing with other countries, we're competing with healthcare systems for the same supply of PPE. So it has been a very chaotic and frustrating process. But we were able to find some PPE overseas. We invested $27 million last week. We got our first shipment of that. So the N95 masks, the gowns, the face masks, all these things we're ramping up. And so I won't say that we have as much as we would like to have, but that process is moving forward nicely. I'm more worried right now about the testing capabilities and the challenge of getting swabs, that type of thing. Regarding PPE, we're in pretty good shape.
Are there talks about stockpiling PPE for perhaps another event of this sort in the future?
You know, you learn from all of these experiences, and I think that's one thing this country will learn, that we weren't as prepared as we should have been for this pandemic, and if and when we have another one, we're going to be prepared for it.
There hasn't been one this serious in almost 100 years.
That's right.
All right, our next viewer question is coming from Andrew, who is an election official in Norfolk.
With 3 more elections coming up this year for the state of Virginia, what steps will you be taking in order to make sure all election sites, officers, and officials are protected during this COVID-19 pandemic?
All right, so you've already moved one.
Yes.
We'll advise.
Well, and thank you for doing all you do at our polling places. So we have a general election on May the 5th. I have proposed to move that to November. Just because that's right in the peak of when we're going to see the most cases, we think, in Virginia. And voting is just so important. And so nobody should have to choose between contracting a virus and voting. So we want not only the voters to be safe, but we also want our poll workers to be safe.
Many of whom are elderly.
Exactly. Great point. So we have proposed to move the May 5th election to the November election. There's also a primary election for the U.S. Senate and congressmen and women on June the 9th. We have moved that to 2 weeks later to June the 23rd. The legislature, as you know, comes back to town tomorrow, just by coincidence, and so they will need to vote on moving the election from May the 5th to November the 3rd. And I hope they think about people's safety, the voters, and especially, as you said, the elderly poll workers, and support that recommendation.
A couple of Democratic state senators want to move that May election to the end of June instead of November. I imagine you hold your position because it may not be enough time to really find our way clear.
Well, and it's very, very complicated, Juan, and I don't want to get into the weeds, but the general election is different from a primary, so you can't have those on the same day. And in our code, we have to wait 30 days between elections in Virginia.
Oh.
Yes, so there's a whole lot of complexities to it. And there's no good answers to all this, but we have tried to take all of those into consideration and really do what's in the best interest to keep Virginians safe.
But the primary election is within your executive power to move at will. The general election will require the approval of the GA, which comes back tomorrow.
Well, just to come full circle, the May 5th election, I can move that 2 weeks as well, but that still puts us in the middle of May, and it kind of defeats the purpose.
Doesn't really help.
Yes.
Okay. All righty. One of the most frequently asked questions we've received since the pandemic began, the questions, I should say, relate to firearms. Let's listen to Mitchell now from Roanoke.
Why are the indoor ranges being lumped in as indoor amusements as opposed to a necessary part of safely learning how to handle and use firearms that are being purchased in our stores and other stores around the Commonwealth?
Looks like he's there at a gun shop. Go ahead.
Yes, great question. And we've made some difficult decisions, but anywhere there's an opportunity, especially in a confined space, to have 10 or more people, or to not be able to abide by the social distancing, we've made that decision. So right now that closure is in effect through May the 8th. I'm hopeful that if we continue to do the things that we're doing in Virginia, that we can lift that and let these businesses get back up and running But it's not that we're trying to single out anybody. We're just trying to do what's safe and responsible for Virginia.
All right, let's wrap this up if we can.
Yes.
The pandemic has brought all of these horrible things to our lives, a change in the way that we shop, a change in the way that we look at each other, the way we greet each other. Where in all this tragedy do you find hope? Where in all of these changes do you find opportunity? What can you say to Virginians out there who may be despairing this evening?
Yeah, this has been so difficult for so many people, Juan, and people all across Virginia have had to sacrifice, and the sooner we can get this behind us, the better. But, you know, as I have watched Virginians respond to this, first of all, our hospital workers, our nurses, our doctors, the staff that are in there every day protecting people's lives, our first responders, our law enforcement, our firefighters, our teachers, just the average citizen out there that goes and checks on their neighbors, that contributes to the food bank. As I said, we're all in this together. And so what gives me hope is the response that I've seen from Virginians. And I'll remind them again, we live in the best state and the best country in the world, and that's why we're all proud to be Virginian. I would just encourage everybody just to be patient, hang in there. We're going to get through this together.
All right. Thank you, Governor Ralph Northam, for being with us this evening and answering our viewer questions. It's been a great pleasure seeing you.
Thank
you. We wish you and the First Lady well.
Thank you, Juan.
When we come back tonight, we'll talk to Virginia Senators Mark Warner and Tim Kaine. Don't go away. Virginia responds.